opinion, what is perhaps the biggest lesson we learned from the COVID-19 pandemic?
Good to be with you, Asieh. I really think there are hopefully a lot of lessons that many countries, including the United States, have learned. As a doctor and a frontline healthcare worker, one of the key lessons is really supporting frontline healthcare workers and essential workers, both in the short and long term, in terms of their needs, in terms of caring for patients. Another one is really real-time surveillance and data gathering and sharing, both locally and internationally. In the United States, if you remember, Italy was a few months ahead of us in terms of what they were seeing clinically. The United States really needed to watch and learn from that. And then locally here, New York City and state saw a lot of the first cases and deaths, and New York was so heavily hit. What the local government here tried to do was inform other states within the United States, hey, this is what's happening. Make sure you get your hospitals prepared. Make sure you have testing kits. So those are some of the key information. And the third key thing I would really emphasize is that public health and scientific experts need to communicate to the public clearly and with transparency, including admitting what they don't know, because to me, that goes a long way in terms of building trust with the public.
Yeah, I mean, when you think about COVID, I mean, I think it's so surreal what the entire world went through. In terms of the pain, the losses, the isolation, Dr. Roy. So having mentioned all the lessons we've learned, are we ready for the next big one, the next pandemic?
I'm so glad you're asking that, Asieh, because let's be really clear to your viewers, to the audience, we will have another pandemic. It's just a matter of time when that will happen. And it's so important that we are prepared and ready. The short answer is, I think we're in a better position today than we were, say, back in 2020. However, I think we still have a long way to go to building our systems, particularly our healthcare systems, and also making sure that we address health inequities. And because every country faces them, the United States is no different. We saw a lot of disparities in terms of who got treatment, who got diagnosed, who got tested. And so we really need to make sure we address that. I think we still have a long way to go. And in terms of, we need to address mental health issues, because today we are still seeing the adverse effects, long-term effects from COVID-19. So the short answer is, I think we're in a better position, but we're really not where we need to be yet. We need to devote a lot more resources as far as funding for public health systems and funding hospitals, and improving the overall mental and physical health care of our existing patients and public.
Yeah, you make a great point there, Dr. Roy. So let's talk about this latest COVID variant. Yes, believe it or not, we have another one. You know that better than I do, JN1. What do we know about it? How worried should we be?
Yeah, so again, how many variants have we already been through, right? We know that, remember, so it started out with SARS-CoV-2. That was the initial virus. And that viruses, as with almost all microorganisms, they mutate. And so the key is to make sure that we are still practicing good prevention measures, that we are vaccinated. We don't have, obviously, a vaccine or a booster for this particular variant. However, making sure we are up to date with all the existing COVID vaccines and boosters, that's going to be really key. But really optimizing our health is going to be really key. So making sure we are already healthy, well hydrated, getting good sleep, all of these things really matter in terms of boosting our immune system so that we are optimally able to fight off any of these new variants that are coming along, Asieh.
And Dr. Roy, we're out of time. Very quickly, would you recommend wearing masks again in public, crowded areas?
Great question. What I would advise is for people to look at their local areas, because there's variation in terms of how this virus is spreading, who's getting infected. So look into your local public health departments and their recommendations. If you're in crowded spaces, I would definitely consider wearing a mask, and especially if you are somebody who's immunocompromised or elderly, or you're at higher risk for getting severely ill, hospitalized, or even dying. Please, by all means, wear a mask.
Yes, and the right mask. Dr. Lipi Roy, thank you very much.